Efficient gas exchange is the result of an intimate match of regional ventilation and perfusion across alveoli. A mismatch between ventilation and perfusion is the most common cause of hypoxemic respiratory failure requiring intensive care unit admission. However, regional VQ assessment is cumbersome and not available at the bedside. As a result, treatment is usually guided by trial and error approaches, which can lead to wrong or delayed interventions. But how can VQ impairments be identified and tracked at the bedside? Timpel 2100 enables clinicians to identify and track ventilation-perfusion mismatch at the bedside without radiation or transport to CT, providing immediate feedback on the effectiveness of the interventions.
With Enlight, we can look at the perfusion that's coupled with it. We can look to see, is that just expanded or is it overexpanded? We can really see what's going on with that region of the lung.
During the injection of a hypertonic saline solution, blood impedance temporarily decreases. Detected by Timpel 2100, this impedance change indicates how blood flow is distributed within the lungs, offering a direct measurement of perfusion distribution. Pulmonary regions mostly perfused and mostly ventilated are indicated by overlapping the distribution of ventilation and the distribution of pulmonary blood flow.
As we looked at the perfusion of the lungs, we were able to see that the perfusion distribution was essentially equal. So opening the left lung was incredibly important to restore the gas exchange for that patient.
Several studies and comparison with angio-CT demonstrate the accuracy and capability to detect pulmonary embolism. Suspicion of pulmonary embolism, to detect areas of reduced blood flow but preserved ventilation. Pneumonia, to assess the impact of the infection on lung perfusion. Atelectasis, in cases requiring prone to optimize lung recruitment strategies. Inhaled nitric oxide or inhaled prostacyclin, to evaluate the dose and effectiveness of the therapy. Assessment of pulmonary reperfusion, to monitor the effectiveness of interventions. To identify regions underperfused due to excessive PEEP. By identifying and tracking ventilation-perfusion mismatch at the bedside, clinicians now can pinpoint the underlying cause of abnormal blood gas levels and implement targeted interventions.
The Enlight technology allowed us to really hone in on what was going on with both the ventilation and perfusion and how that matching looked. So being able to use Enlight technology and really identify the problem or potential problems is incredibly helpful.
Timpel invites you to enter a groundbreaking era of ventilatory care with VQ at your side.